Hey, what's up, guys? Welcome back to Seeing 2020's YouTube channel. We're so grateful for you guys to come out. The last video that we had on here was so cool. It was a podcast style video that we did with the producer, Dr. Koshar, and with from the movie, Dr. Urso. It was a really great conversation. We talked about research and the mounting research that is showing that there are things we can do as early outpatient treatments. I love when I have the doctors on. I'm just a filmmaker. I know how to do research. I know how to build my own opinions, just like everybody should learn how to do. And you don't have to be a doctor to be educated on an issue, but I think it's really valuable to bring in experts, doctors who have the history, who have the background, and mostly because they have the experience. They're in the trenches. They're treating patients. They're doing research. They're seeing results. And so it's really helpful to have doctors who've treated on the podcast talking about, what their successes were, where they found the evidence, how they came to those conclusions is super, super valuable. Today, we have a really awesome announcement. We have screening events that are going to be happening in Texas, 3 in particular. They're going to be in Dallas, Houston, and outside of Austin. They're going to be on the April 16th, 17th, and 18th. So if you go to eventbrite.com, you're going to be able to find links. I'm also going to put the links in the description down below. If you know someone in Texas, if you live in Texas, if you're going to drive to Texas, that's where our first screening events are going to be. It's really exciting. We're going to have doctors from the movie there for Q&A sessions. I myself am going to be there. The producer, Dr. Koshar, is also going to be there. So we're super excited for these events. It gives us an opportunity to have freedom of speech, to have conversations, to take questions. So we're so grateful for the event organizers over at AFLDS. They're volunteers. They're amazing. If you want to support them, go to aflds.com and support them and donate. All the proceeds from these theater events are going to go 2 ways. One's going to be towards AFLDS and their organization. The other one's going to go to Seeing 2020, which is our production company that's going to help us fund our next movie. So we're so grateful for these events. We're so grateful for the doctors for being willing to come to these events. Like I said, descriptions will be in links will be in the description down below, and that's where you can buy tickets. And tickets at the door are going to be $20, and tickets pre-ordered at what is it called? Eventbrite. At Eventbrite are going to be $15. So if you pre-order them, it's cheaper. So go ahead, pre-order them. It gives us an idea how many people are coming. And moving on. So today I'm going to show another raw clip, a part of the interview. This is with Dr. Mark McDonald. Now, he's awesome. He is a wonderful resource when it comes to mental health. He's a mental health expert in California. He works with a lot of youth, a lot of young people, and so his perspective is so interesting. Today, we're going to be talking a little bit, or I'm going to be showing a part of the interview where we asked him to go into a little bit more detail on what he thinks in regards of the patient-doctor relationship, how that's changed during the pandemic, and why so many doctors don't treat COVID as an early outpatient treatment. There hasn't been a lot of talk, and still at the NIH website, there's no real good recommendations in regards to early outpatient treatment. In fact, I've talked to doctors that I really trust, that are good people, when asked, what do you do for early outpatient treatment? The response is still, well, there's really nothing that works. We can try a few things, but there's really nothing that works. Now, last week, if you want to go check it out, we talked to Dr. Urso about this and how many options there are that you can help fortify people's immune systems, to help treat them as early outpatient. It's great recommendations, great information for you to take to your doctor, your primary care doctor. So I'm going to turn it over to Dr. Mark McDonald. This is part of the interview that didn't make it into the movie. And I'm going to give him a chance to share his opinion in regards to early treatment and why doctors may or may not be using it.
The change in both the way doctors practice and the way patients work with them is, in my view, entirely a consequence of misinformation. There are, of course, people in certain positions that I believe know that things that they're saying and repeating are false, and they're doing it malevolently. But I think most patients and most doctors simply don't know any better. And they have been just deluged with lies, misinformation, slander, libel for so many months now that they've come to believe the lies. And when I talk to physicians and they bemoan the fact that hundreds and thousands of patients are dying in their clinics and hospitals every day, and I ask them, well, how many of those patients received, say, early outpatient treatment for their symptoms? They just sort of stare at me as if I'm asking a question in Chinese. And I ask it again, and they say, well, there is no outpatient treatment. And then I realize that medicine has essentially failed, and it's failed the patients who also believe that there's no effective outpatient treatment. And only a vaccine is the way out at this point. And so both doctors and patients have now completely transitioned their way of practicing medicine and receiving treatment to this Hail Mary pass of waiting for a vaccine and ignoring decades and decades of scientific practice for treating illness, which I've never seen in my career. I know several physicians personally who agree entirely with my view on how to treat coronavirus, on the effort to control doctors by pressuring them to not prescribe, to insist that all the failings of the government response to the pandemic have to do with one political party or another, and yet they don't speak up or say anything in their hospitals or in their clinics because they are scared to death that they are going to be not just censored, but actually called out by angry patients or by medical directors for violating some sort of new community standard of care, and that they may even lose their practice and lose their license. The pressure on doctors today, especially doctors who are not fully independent, but who are working as part of a larger group or a hospital system, which is most physicians, the pressure is so overwhelming for them to toe the line, even when they know that it's wrong or that it's hurting patients, that they have to make the choice of either putting their career and perhaps their family's sustenance on the line or doing the right thing. And sadly, most doctors are just not up to that task today.
Getting to meet these doctors was so incredible, and giving them a chance to have a voice, I think, was so valuable. We're grateful to these doctors for taking that risk. We know that they are part of this science and medical community that's going through a bit of a battle right now. And, you know, it's important that we don't silence anybody. We give everyone a chance to give an educated opinion. And, you know, it's interesting because as he's talking about how he thinks it has a lot to do with the exchange of information and the silencing of information, rather than these doctors doing the wrong thing, right? Doesn't seem to be blaming it. And in all of our conversations we've had with him, he never seemed to blame or put down or kind of put a negative voice on these other doctors. Never said it was their fault, or even said that they are doing it on purpose to hurt people. None of that kind of thing. It was all just, you know, they're the result of what happens when you silence science and you don't give science a chance to communicate and have open debate. And so he's just an awesome guy. He's always willing to talk. And like me, and a lot of the people in the documentary, including our producer here, Dr. Koshar, we really are about freedom of speech, giving people the right to disagree, to try different things, to figure out what's going to be the best solution. And so really grateful for Dr. McDonald. Such a good guy. We're so grateful for the clips that he was able to give us for the movie, and that we were able to roll out more content for you guys here on this YouTube channel. So don't forget to like and subscribe. The more people who watch, the more people will learn about what we learned when we made this movie. We're so grateful to our audience. We're so grateful for all that you've done for us. And we look forward to seeing you next time and bringing you more great content.